I'll be speaking on long-term outcomes of therapeutic corneal transplants performed in tertiary care hospital in South India. So infectious keratitis in India is 10 times greater compared to other developing countries. Other developed countries, and the incidence rate is about 1.5 to 2 million cases added, and this is added annually to the existing numbers. And there is a significant number of such corneal blindness are mainly due to infectious keratitis because of perforations as well as loss of globe integrity. Corneal infections are 63.6% and is a most common indication for TPKs. And this is an overview of the 15-year statistics of the keratoplasty at our center, and 2016 is the year that is considered for the study. It shows about corneal ulcer of 1,141 with a TPK done about 196. Now, the purpose of the study was, the primary objectives were to find out the outcomes of TPK, that is anatomical, therapeutical as a functional level at 6 months as well as 3-year follow-ups. And the secondary objectives that were done were mainly compliance to the follow-up, uptake of the optical grafts, as well as how effective it was in eradicating the corneal blindness. The methods that were done was a retrospective chart review of all patients who underwent TPK in the year of 2016 in Arvind Eye Hospital, Pondicherry, and there was about 196 TPKs done and about 140 optical keratoplasties done. But even though even though there was 196 TPK, the sample was only taken for 149 grafts among 135 patients, because based on the case records that are available. So the outcomes measured were the anatomical success was based on the grafts that retained the tectonic integrity for the globe after TPK, and therapeutic success, grafts that achieved healing after TPK, and functional outcome. The results include, it was 85 were males and 50 were females, and mainly was in the age distribution of 41 to 60 years. The preoperative features, in which the most common visual acuity they were presenting was hand movements, and perforations were among 65 of them. And the time between the temporary stabilization, that is through glue BCL, to surgery was 6 days, and the time for decision making to performing of the surgery was 4 days. So of this TPK, all the TPK done, the therapeutic purposes was 8 for 80 purposes, tectonic was 7.5, and 1 was done for as a therapeutic DAL because it only involved the anterior stroma, and re-TPK was about 12.1. This was a graph showing the the indications of TPK, and infections were non-traumatic perforated ulcer was the 66 of them. And the most common infectious etiology was in bacteria, that was Pseudomonas, as well as in fungus was Fusarium as well as Aspergillus. So of 89% of TPK, that was with the primary success, for 41% underwent primary success, and 44 had an additional intervention done, such as intracameral voriconazole and moxie given, or even core vitrectomy done, and 11 underwent repeat TPKs, of which 1 had underwent evisceration. So this was the anatomical outcomes at the and functional outcome at 6 months and at 3 years. So the graph status was that. Should I continue? Okay. So the graph status was that about all the TPK done, 89% had a failure, and only 11% had a functionally optical graft. And of the follow-up, we see that at the end of 6 months, there were 1 or 2 patients, but at by the time it reached 3 years, it was only 32 patients left. And optical regrafts that was done for only 23% of the cases. And those who went for secondary complication were the following, based on endophthalmitis, glaucoma, and late graft infection. Of the total graft outcomes that was seen after 3 years, there was 62% failed, and of the 38% that had a clear grafts, that had about 74% who underwent a optical keratoplasty for the functional outcome. This was based on comparison to other studies. So, for a good therapeutic and anatomical outcome of the TPK, the therapeutic success was only 89%, and the anatomical success for maintaining the integrity of globe was 86%. And this was comparable other studies. Even though there was an overall graft outcomes based on function was poor because of the poor quality of the TPK graft that was used in the study. And there was a high number of perforated cases because they have come for late presentation and poor graft quality that was used. But however, there was no steroid that was used because even though there was no steroid use. Now, the poor follow-up rates among keratoplasty patients were 85% followed up till 6 months and only 31% followed until 3 years. And they were in the low socioeconomic group, and major problem was a functional impact. And there was poor uptake for optical keratoplasty, and only 23% underwent optical keratoplasty. So, to conclude, there was for preventing, there will be strengthening of the primary care treatment, and awareness programs should be conducted among public and doctors, and treatment based on the decision for the right time to take up for TPK and efficient usage of donor tissue, that is either for lamellar or gamma irradiated grafts. And visual outcomes was to prioritize for optical keratoplasty and drug-eluting sutures. Thank you.
All the speakers, please stick to your times so that you will lose your, if you cross the 4 minutes, that definitely you will lose your marks. So because give us to ask 1 or 2 questions, Anna. So when you cross your 4 minutes, then we don't have time to ask. So basically it's okay. So I have one question for you. So this is all about the descriptive retrospective data analysis. So can you give me one example of the limitations, the biggest challenge when you analyze the data, retrospective data? So what is the challenge?
So the main problem was no, we were not able to take up all the patients that was included in that year of 2016 because the case records were not available, and the follow-up was difficult because the patients did not follow up, and at the end of 3 years only 32 patients we could assess the outcomes. So that was one of the drawbacks or limitation of this.
Yeah, so just for the education purpose, yeah, that's okay. So for retrospective data analysis, the biggest challenge is because data is so incomplete. You know, so when you want to do an advanced analysis in terms of logistic regression, multivariate analysis, we do not have a data. So there is the biggest challenge, biggest limitation when you analyze the data retrospective regression. For prospective, you can think of what are the, I mean, according to your needs. So to me, that this is the biggest limitations. You do not have a data, complete data to analyze further. Thank you.
Thank you, Dr. Megha.